Blood pressure, it is a like currently a very important and crucial disease, most common cause, one of the common cause of morbidity and mortality. So for vitamin D lifestyle modification, first thing is weight loss. Weight loss is very crucial cause fat deposition anywhere in the body that do cause the sodium and water retention, that may cause hypertension, and that do decrease our exercise capacity. High weight, it causes sleep apnea. What is sleep apnea? When a person is obese, he has deposition of fats in his neck and anywhere in the body, so that person is not able to sleep easily, and person has difficulty in breathing in the night. So obstruction in the breathing during the night causes sleep apnea. The decrease in air entry to the lungs, which causes decreased blood flow to brain and lungs and heart. So it can cause further obstructive sleep apnea, which is one of the common cause of hypertension in the obese people. So after obesity, second thing is we have to do the daily exercise. In the exercise, it can be moderate exercises, which include the cardio, which can be cycling, which can be running, jogging. So at least as per recommended, we should perform 30 minutes of moderate exercise daily, at least 5 times a week, and 30-minute daily. That should be performed as per the criteria. And if someone is involved in the high intensity exercises like weightlifting and others, that should be performed at least 20 minutes a day. So other than the cardio, person can do squats, then jogging, squats, swimming, cycling. They are all part of it. Then in the lifestyle, we should have a proper sleep pattern. At least 7 to 8 hours of sleep is required daily in the night. Uninterrupted sleep should be there. And to do that, we should avoid using phone in the night. And if someone has any sort of obstruction in sleep, anything which is preventing you from taking good sleep, you can use earbuds or anything to have a proper bedding is required, and proper area ergonomics should be better for sleep. Then stress is the important part. Stress actually it causes increased blood pressure by increasing flow of blood in the vessels. So person should have no triggers for stress. And these are the common lifestyle modification. First, we will start with the foods which should be avoided. There is a direct correlation between hypertension and sodium intake. So, sodium comes from the common salt we take daily, and we should need to see the point where do we get the salt from. All the foods, the fortified foods, the preserved foods, they should be avoided. They are high in, cause even in the pickle, the commonly Indian household, they have pickles. Everyone is using that pickle. So pickle, for preservation of the pickle, we use a lot much amount of salt. So that should be avoided if someone is hypertensive. And the recommended daily allowance, the recommended intake of sodium, which is applicable, which should be done for a hypertensive person, is less than 23 milligram of the salt. Not sorry, 2300 milligram of sodium, and that goes to 5 gram of the common salt, 1 teaspoonful of the common salt. But a person, if he the applicable thing is it should be actually less than 1500 of milligram of the sodium. But if it is less than 2300, that is also good. Then we should avoid the poultry, the high fat foods that contains the meats, the high fat meats. We should avoid that. We should avoid the poultry that has high of unsaturated fats. And then I told you the high cold drinks, the drinks which contain the high sugars, high dextran level, high sucrose level, they are also responsible for hypertension. And the cold drinks, carbonated waters, and then even in the breads, the bakery breads, they don't taste salty, but in the making process they use salts in them. And the salt we use on salads, that should be avoided. The common things, we should not use the salt over the salads or over the foods and pickles. These are the common things we should avoid. And the things we should take, potassium diet is advised in hypertensive patients, and even in anyone, because potassium is important for our circulation in the heart and in the brain. And high the sodium intake should be decreased. This is known as dash diet. Actually, dash diet was developed by WHO and World Health Societies previously, like 30 to 40 years back, and it is even used now. Dash is dietary approach to control the hypertension. So, as per the DASH diet, we should have food low in the sodium and high in the potassium. And for food intake, the fruits, we can take the banana. It has high potassium intake. Then leafy vegetables, then legumes, cereals, and the pulses we do take. They have high potassium and high fiber intake. And the foods which have high fiber in the vegetables, in the fruits, then beetroot, it is a good source of potassium. And these are the good foods which should be taken to prevent the hypertension. Stress, initially, previously, we also discussed stress is it can increase symptoms of any disease. Stress, there is no direct correlation between the chronic hypertension and cardiac remodeling with the stress. But what do stress cause? It causes temporarily or paroxysmal, like at a point of time when a person have stress. It causes a high increase in BP at that point of time. It can go beyond systolic BP can go beyond 200. And what do it cause? The stress, if person is like stressed up for a long time, these gradual and slow high BPs, they can cause cardiac remodeling with the time. So that can cause hypertension. So any sort of stress, any sort of tension, that should be avoided, even in people who are non-hypertensive. If someone is non-hypertensive, stress even can cause increase in BP in those patients, and gradually with the time that patient can be part of hypertensive pre-hypertensive stage. Then in the hypertensive stage, that patient can come into that. So stress should be avoided. Good sleep, as I described earlier, a good sleep is required for good health. And if you have a non-stressed body, you'll get a good sleep, and that will be good for your heart and your blood pressure. Exercise, initially, as we discussed, the weight loss exercise will cause the weight loss, and that will be helpful in the hypertension. And then with exercise, we'll have a loss of sodium from the body. They'll equate the sodium levels in the body. Then there is cardiac functioning improvement, cardiac strengthening with the cardio exercises, and they are helpful in improving the cardiac health and the bone health of the body. And directly, it is there is a release of the good hormones in the body, and there is reduction in the stress with the exercise and daily cardio activities. So that way, it is helpful in reducing the BP and maintaining the BP. It is as per some studies, they say by reducing BP of weight of around 8 to 10 kg, there is reduction in systolic BP of around 7 to 10. So approximately with every kilogram loss of weight, there is a reduction in your normal average blood pressure by 1 mm of mercury. So if someone is obese and in the category of obesity, that person can, even if someone is on one drug for hypertension at low dose, that person can be drug free if he or she reduces a significant weight, and so that person can be drug free and get rid of hypertension. If someone has high BP, that is more than 130 by 80, at different two occasions, within 24 hours, that person is hypertensive. And if someone is hypertensive, that person should check BP at home. And initially, that person can check BP in the morning and in the evening, because these are the two times, and it should be written differently: the morning BP and the evening BP, because there is difference between morning and evening BP. Initially, at first visit, or within two visits, first and second, the person should check BP twice daily. Then after that, if his BP is normal and he's taking treatment regularly, after that patient can check once a day. And if it goes normal, then it should be like once a week or twice weekly maximum. Because if you are checking BP daily, there is difference between even in your upper both limbs. The normal difference which we say of systolic and diastolic BP is 20 by 10 mm of Hg. That is different, but difference between both of our upper limbs. So you should not get cautious or stressed by the thing that upper one of the limb has BP of 140 by 80 and other has 155 by 90, because that is clearly normal. A difference of 20 mm of Hg in systolic BP between less than 20 between the two upper limbs, and diastolic of less than 10 mm of Hg is a common thing. Then there are some things we do tell people, okay, they should avoid before checking BP at home. They should not take coffee. They should not have taken alcohol. They should not be speaking. There is proper method how you should bind your sphygmomanometer on your arm. So these are the things we do tell people. And if person will be checking BP 3 or 4 or 5 times a day, that person will get anxious. So initially it is 1 to 2 times in the morning and in the evening. Then after that, once daily, and subsequently, person should check it like once or twice a week. So that is good enough.